everyone, and welcome to episode 38 of Divergent Dialogues. Today, we'll be talking about understanding the therapy process. So, I think today is going to be a bit of an interesting conversation because I think this is something that Tina and I have had a discussion about a few times, just about, sometimes people don't 100% understand what therapy is or what you've got to do or what it looks like. Um, but I think like there can be some barriers, particularly for autistic ADHDers when engaging in therapy because they may have had some experiences that weren't so helpful or validating for them. So yeah, I guess to start off with, it might be worth exploring some of these barriers and then maybe talking a little bit about, what the therapy process looks like for us. Like obviously different therapists, people from different professional backgrounds, they might kind of show up in a little bit of a different way. And obviously, Tina and I do take that, neuroaffirming approach. So this is, I guess, our spin on it. But generally, like, there's a lot of common things that kind of happen in that process. So, yeah, Tina, I guess, like, what are some of the common things that your clients might talk to you about in some of their first appointments, maybe some of their concerns or issues that they've experienced in the past?
Yeah, good place to start. I think, one of the things that I notice happens a lot in that first appointment, and people have actually shared with me that, "Oh, I almost didn't come today, or I was going to cancel this appointment." And the reason that they share that is they say, I didn't know what to say. I didn't know, like, I don't know how to say why I'm here or what I need help with." And I'll then ask them, "Well, what was the thing that happened to prompt you making the call in the first place?" And, I'll reassure them it doesn't matter how little it was. It might have just been that you had this moment where you thought, "Ah, fuck this, I'm done," and you picked up the phone. But that's, yeah. And when I ask that question, people can usually, give me a bit of information, and then the story sort of starts from there. So, and yeah, it can be different for a lot of people. Some people have been contemplating making an appointment and reaching out for help for a little while for something really specific. Other people, they just feel that they need an outsider's opinion, thoughts, understanding on life.
Yeah. Yeah, I think that is a really common one where people like they have this sense that they need support or they can feel that they're really struggling emotionally, but they're not sure what to talk about. And I'll let everyone in on a little secret. When I first meet a client, I don't know exactly what I'm going to say either. Like, I'll say, I don't know exactly, obviously, like when I first meet a client, there might be some typical kind of questions and things that I'll ask, obviously, to get a picture of, what's going on and things like that. But um, like in some of the forms that I have before people come and start working with me, like I do have some questions around, oh, what are you coming here for support for? Just to give people a little bit of time to have a bit of a think, so maybe they're feeling a little bit more prepared. But even so, like sometimes people will come and say, look, I'm here to get some support around this. And once we start talking and kind of unpacking things a little, it comes to light that there's, a lot of other stuff going on, or maybe something that's going on that they didn't realize was such a big challenge for them. So it's okay to be a little bit nervous, and like you don't have to know exactly what you're going to say. Like in the first session, it's really about making sure that you feel comfortable with, the therapist and their approach. And like you can ask questions as well, like, ask some questions about them and the kind of like how they work and all those kind of things. But also, I guess it's kind of like this space where, obviously the client and the therapist are coming together, and we're both kind of trying to figure it out together. so that we can come up with like a collaborative understanding and a way to move forward. It's a co-created space, and it's okay to just kind of show up as humans trying to figure it out. And a neuroaffirming therapist will want to like collaborate with you, not necessarily you come in and go, okay, well, this is the plan, this is what's happening. Da, 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 da. Like, obviously therapists bring their expertise and their training and whatever therapeutic modality that they have to the room. But it should really be, in consideration of the needs of the client, and also like their preferences, and, honoring their lived experience and their autonomy as well.
Yeah, absolutely. I'm a very, very big believer in you are the expert on you. And I think that when from a therapist perspective, when we kind of understand that, yeah, we're the therapist and the client, we're on the same level in terms of our expertise. I have a lot of expertise in what I know, what I do, but you have all the expertise in you. So it is this shared space of testing ideas and seeing how it fits and working together. Really, it's I think it's very important.
Yeah, I agree. And that's what I say to my clients. I'm like, especially in the first appointment, I'm like, well, you're the expert on you. So, like, if we can create a space where you're feeling comfortable enough to share, show up as yourself and share, we can kind of work together. But yeah, I can understand. I work with a lot of late diagnosed folks who have unfortunately had some bad experiences previously, where they may not have been identified, and they may have received other diagnoses or support that wasn't a good fit for them, and things like that. So I think sometimes there can be a lot of anxiety around that, because they're like, oh my gosh, like, is it going to be like that again? And I think it's like, obviously, like, different people are gonna have different fits with different therapists. Like, I might have 10 people come and see me, and maybe not all of them would like my approach, and they go to someone else and that's a good fit for them. So um but I would say that, obviously, you at a baseline, you're wanting to feel supported and validated and safe. But, I think, I guess what I'm trying to say is it's okay to feel a little bit anxious, and it's okay to have a little bit of apprehension. And at the end of the day, if you do meet someone and you don't feel like they're a good fit for you, you don't have to go back and see them. Like, you can, find someone else as well. So, if you don't feel that, that's okay. And you don't have to keep on going if, because you feel like you have to, if that makes sense.
Yeah, I think that's really, really important because a therapist can only really be all over a few things. You can't be good at everything, and I think that includes different presentations that people come along with, different problems they're working on, and different therapeutic approaches. And if, yeah, you finding a therapist who is, skilled in the area that you're looking for support in, but also has therapeutic approaches that fit for you, that's really important. And if being able to recognize that, oh, I felt a bit uncomfortable with that person, or, gee, they didn't make sense to me because they were talking like way too technical, or even the opposite, like I didn't really feel comfortable because their approach was way too casual and I kind of want something a little bit more structured and intense. Having that conversation with the therapist is absolutely okay. Asking about the different approaches that they use, but also deciding that, okay, I actually don't feel like this is a fit for me because of whatever reasons. It's important because it's your journey, and it needs to be comfortable and fitting for you.
Yeah. And I think like I work with a lot of PDAers because my approach is quite flexible. So they really appreciate that. And of course, like if someone voices that they would prefer more structure, then I'm happy to do that as well. So
Mm.
it's, I guess therapists will have like a baseline approach and obviously they have to stick within their training. So if you're going to a therapist and saying, oh, well, I'm wanting to do EMDR therapy and they're not trained in that, like, they can't do that. But generally, like a neuroaffirming therapist will want to, have some flexibility in, how the therapy is delivered or how that's communicated or, I guess what that looks like. And it's okay to speak up. And, if the therapist is explaining things in a way that doesn't make sense for you, um, share that and just go, hey, like, I really appreciate that you're sharing this, but like, maybe I need this in an image or an infographic that would make a little bit more sense to my brain. So like the neuroaffirming therapist should be curious about those differences, but also like, that's really important information for us to have. Because if we don't know, we're just exploring. But if you tell us, and it's like, okay, well, there may be quite simple solutions to some of these discomforts or anxieties.
Mm. And if you're new to therapy and you don't really understand what it means when we're talking about like different therapeutic approaches, uh, the therapeutic approach is just a framework for which we would use to support a person. And more times than not, my therapeutic approach with each person ends up being quite eclectic. It's not necessarily straight CBT or straight acceptance and commitment therapy or dialectical behavioral therapy. It's often like a little bit of a few things. And I don't know that I've ever had someone other than people requesting DBT. I don't think I've ever had anyone come along and say, I'm here because I would like a course of cognitive behavior therapy for anxiety. I don't think I've ever had that. Um, but yeah, so if you're feeling like, oh, what's this therapeutic approach stuff? How would I know? How would I ask? It's it it comes down to like, how do you learn best, really? Because therapy is a space for learning about yourself, learning some new skills to maybe manage anxiety or whatever it might be that you're dealing with. So if you know a little bit about how you like to learn, then you've got an idea of what kind of therapeutic approach might feel right for you without having any knowledge whatsoever of the different therapeutic approaches that someone might use.
Yeah, yeah. And I think, something that is really important is that you do feel like it's that process of exploration and supporting you in the way that you would like, and that you don't feel like you're a problem to fix. And I think for a lot of my clients, just exploring their neurodivergent experiences and understanding them from that neuroaffirming lens, it's a big like life changer for them. And we're not necessarily doing any like fancy therapy. It's really important that you feel supported in the ways that are a good fit for you. But it's also, I'm not saying that every single neuroaffirming therapist necessarily has to have lived experience, but I find a lot of my clients really benefit from that, and it's like it's just really affirming for them. And I think that there's a lot of ways that I can kind of show up in that space for them where even like a lot of people they'll see on my website, they'll be like, oh, I knew that you were neurodivergent, so that's why I came to see you. And just having that information, I can tell that they already feel a little bit relaxed even from the very first appointment.
Yeah.
And I think it's just not feeling like they have to explain themselves as much because, obviously autistic ADHDers, we're all different, but, there are a lot of common experiences. So it just saves them a lot of talking and a lot of explaining. And, I can just be like, oh, hey, like, is this kind of what's going on? And they're like, yeah, like that's exactly what's happening for me. Um, so yeah, I think that can be really helpful. And I think just, honoring your lived experience so that you can kind of show up in the way that you feel comfortable as well.
Yeah, I completely agree with that because yeah, even in that neurodivergent neurodivergent space, we interact differently, and feeling comfortable to do what you need to do, be who you need to be, communicate in a way that you're most comfortable with. It can be a really powerful tool for your own healing and growth journey. So yeah, I think being happy to, and it's not always easy, like I think that offering feedback, or you don't have to tell a therapist like, oh, I don't like you, I'm moving on, or this doesn't work for me, I'm moving on. But knowing, having a way to do that for yourself, whether it's just, oh, look, thank you, but yeah, I don't need to book another appointment, whatever that might be, but just know that you can, and it is a part of the process of finding your space.
Yeah, and I mean, like, sometimes, like, a lot of people, they may not need therapy medium or long term. They may just have a few specific things that they're wanting support for, and then, they've come to therapy, they've met, some of those goals, or, they feel like their needs have been met in that space. And, that's all the kind of support they're needing. And then, maybe a few months later, a year later, they might need more support, or whatever that is. So, like, don't feel like you have to continue going long term. Like, if you do require long term support, that's okay as well. But I think, yeah, like, you don't want to be turning out feeling frustrated if it's not the kind of the place that you want to be. And yeah, sometimes just being, upfront. And also, like, sometimes, like, there may be other sorts of therapies or professionals you want to explore. Like, we're accredited mental health social workers. Sometimes people want to go see an OT or something like that to meet some of their other needs that might be out of our scope. So that's totally okay as well.
Yeah, absolutely. Yeah, it's all about meeting your needs, whatever they might be.
Yeah. Yeah. So something that I wanted to kind of talk about is that, I don't know, I always get a little bit concerned because sometimes I see some of these TV shows, often American TV shows, um, and they kind of depict therapists in these really dodgy ways. And sometimes I'm worried that people actually think that that's what occurs. But I can tell you right now, if therapists are doing that, like, yeah, like, get out of there. That is really concerning. But there's kind of the stereotype of, um the client is kind of talking and the therapist is like, yes, how do you feel, tell me more. And I don't know about you, but for me as an autistic person, like, having the pressure of just sitting there and having to talk and, like, feeling like I have to hold the conversation, like, that would make me feel nervous. Like, I would be like, "Oh my gosh." So yeah, like, as I said before, it should be this kind of back and forth process. Like, I have some clients that are verbal processors, so they just, they like to get it all out, and that's totally
Yep.
fine as well. Um but, like, I think these days, like, a lot of people, they have, websites or social media and things like that. So you can kind of suss out,
Yeah.
people before you see them. Like, that's a reason why, I wanted to have podcasts so that people can get a sense of me and who I am before they come and see me therapeutically. So,
Yeah, definitely. I'm the same. I remember years ago I went along to a new therapist, and this was many years ago. So before I was sort of working in this space, and before I realized that yeah, you can just not click and need a new therapist. So I in total I think I attended 3 sessions with this therapist, and each of the sessions, like all three of them, she looked at me and would do those sort of, minimal indicators like, yeah, can you tell me more about that? That's interesting. And it was me talking for the whole session. And it was so stressful because I didn't know, am I supposed to be talking still? Should I I'll pause. I'll pause and see if that gives her space. And maybe she's just looking for space to say something to me. But she said nothing, so we sat in silence. And then I thought, okay, I better talk again. And it was just 3 sessions of that, and it was really stressful. So I didn't go back after the third session. I just cancelled. I did feel that pressure to book at the end of that third session, but I sent an email saying, "Oh, I'm so sorry, something's come up. I can't make it. I'll be in touch to rebook when I can." And I did. But yeah, it's so yeah, some people do like that space to do that verbal processing and talking. But sometimes people don't. And I find that when someone is really struggling to answer some of my questions initially, uh, offering some sort of like questionnaires, like easier kind of yes no type questionnaires to help get an understanding of what might be happening for them is helpful, because it takes a bit of that pressure off for the talking, the thinking, the answering, all in that space. They can take them away, do them, in their own time, and that can be a bit helpful.
Yeah, I guess like sometimes like people might really like to read, so I'll give them some like blogs and things to read, or they might want to learn about particular things. So I might even get out some diagrams and worksheets and things like that that we can go through together. I see a lot of ADHDers, so they love to do that kind of verbal process, where they just kind of get it out all out there and then we kind of unpack it a bit. But also like some folks, they might just turn up and be like, I just had a really bad week and I don't really know why I feel this way. And we'll just start from that point and, unpack that a little bit, kind of, press a rewind and go back and go, okay, well, what's been going on? And then I have some clients who like, they'll have a few dot points on their phone and they're like, all right, I'm here. I've got things I want to talk about. And we just go, item by item off the list and work through it in that way. So there's really so many ways that you can go about it. And I guess it just depends on the flexibility of the therapist. Like some therapists may have be trained in particular therapeutic modalities that are quite prescriptive and like they have like a certain protocol and things like that. So they may not be able to be as flexible. But yeah, much like Tina was saying, my approach is quite eclectic. And I think especially in this neuroaffirming space, we're still learning a lot about what actually does work for autistic folks and ADHDers, because a lot of the literature and the research has kind of endorsed a lot of these approaches that have actually been quite traumatizing and harmful for people. So when you're working this space, there is an element of kind of experimenting and seeing, like obviously within ethical bounds and clients feeling comfortable, but it is a bit of a trial and error sometimes, and even with clients, like sometimes we might give an approach a go and then they go, actually, like that wasn't a good fit for me. I didn't find that helpful. And that's okay as well. Like, I'd much rather that someone let me know that so we can try something different than, keep on with an approach that's not helpful for them.
Yeah, I agree. It can be a struggle to get through a therapy session when the person isn't sort of resonating with the approach, and there's this awkwardness, and I think that it is it's not fun for anyone um when it has that discomfort. And I think the people that come along with the dot points, I love that. That's one of my favorites. I used to work with this teenage girl. This was many years ago, and eventually got her into the routine of, taking down dot points in between sessions, because she'd come along and she'd be like, "Oh, I had all this stuff, but I can't remember." She was an AHDer. And so she got into the rhythm of, dot pointing things between sessions, and she wouldn't review her list until she was in the session. And it would always make me laugh when, those first few minutes, and she's reviewing her list to decide what she's going to talk about. And she would have these very funny reactions to some of the things she'd put on her own list. Where, she'd be like, "Oh my God, it's like thinking when I wrote that. Oh my God, I sound like such a sap. I'm not saying that." And yeah, it was always really nice. It was quite funny, and but it was helpful. And even it was helpful even having those things on there that she decided that no, it was way too lame to talk about, because she was able to sort of recognize those different mindsets and how her thinking changes dependent on her mindset. So just the act of putting the list together became a therapeutic tool. So it was, yeah, it was really, it was such a fun case.
Yeah. And I mean, like, just as much as I found as a therapist being flexible with my approach, I think when you are going to therapy, although, like, obviously you want to be comfortable, sometimes it is worth having a think around, like, how open and flexible you are to, giving new things a try,
Mm.
or to change, like, especially for a lot of, like, autistic people, like myself included, like, change is something that's really scary. And that's not just change that we might feel could be negative for us. It can even be like positive change. It's just change. So, like, our nervous systems freak out and go, "Oh my gosh, what's going on?" So, if you, like, a therapist may suggest something that could be helpful, but there might be this anxiety response because it's like, "Oh my gosh, like, I'm being asked to do something differently, and that feels really stressful for me." And that's okay. Like, sometime, if you do have a chat with your therapist, like, it might just be about being a little bit more gradual with it, or breaking it down a little bit, and or even just like talking through the process. Like I do some like trauma therapies and flash therapy, and it's quite different to a lot of other therapies. So, I might just describe to one of my clients the process, and how it works. And then I might let them sit on it until the next session, and then revisit and go, "Okay, like, is this something that you're still, like, feel comfortable to give a go," and all these sorts of things. So I think, like, it's okay to ask for time to process these things, and it's okay to ask for more information. And especially in your first appointment with a new therapist, like, it's okay to ask, what is your approach, and what would a typical therapy session look like, and all these sorts of things. And they might have to go, "Oh my gosh, like, give me a second, I need to have to think about that answer." Like, but it is okay to ask these questions, because often you're spending a lot of money for this support. So you want to make sure that at least you're heading in the right direction with someone, at least for the time being.
Yeah, yeah, absolutely. Yeah, because if the therapist is kind of working to their agenda, and like you were saying before, with that really sort of prescriptive therapy where it's like quite rigid, and no, we have to do this and then this and then this, it can feel like you are on somebody else's journey, and it's like, oh man, how did I get locked into this very expensive training package?
Yeah, exactly. So yeah, I think yeah, it's it can be a really brave step for a lot of people to get to a place where they are open and willing to engage in therapeutic support. So I think it's, like, it's a when you make that decision, it's a big deal, and it's okay to feel unsure and want that reassurance. And I think any therapist that wants, their client to feel safe in that therapeutic relationship is going to want to answer those questions to help them to feel a little bit more comfortable. So if you are asking these questions and then the therapist is, acting in a way that you don't feel comfortable with, then I guess that's information as well to go, okay, well, this is what I feel like I need to engage with this, and I'm not able to get that. So yeah, I think they're really important things to be able to consider. I think something else that I would mention as well is that there's a lot of people that are saying that they have a neuroaffirming approach these days, and on their website and social media. But you might turn up and the way that they actually practice might not align with, I guess, how you feel a neuroaffirming approach would be. Again, like every therapist is going to have their own way of navigating things, but I guess it's just because someone has lived experience or says on their website that they have a neuroaffirming approach, um, that's not necessarily the case, because really when it comes down to it, a lot of us have had a lot of training that was in that kind of pathology clinical paradigm, so a lot of us have to do a lot of unlearning and consideration, and kind of do a pivot with our approaches, and that can take time. Like, Teena and I have been doing this for years now, and this is something that we're really committed to in our practice. But yeah, I think there's a difference between wanting to be doing a certain approach and actually doing that. So
Yeah, definitely.
yeah, so if you feel, if something feels a bit off and you go, oh, well, they said that they like this and they're not, like, that's okay. Like, it's, it might be worth looking for someone else. Like, if you're getting the ick feeling, or you're feeling uncomfortable, you're not feeling safe, especially when it's, the first few sessions, like, don't feel like you have to continue to go. And as I said, like, sometimes it's not necessarily that the therapist is mean or nasty or horrible or anything like that. Sometimes it just might not be a good fit. Like, I tend to like use a lot of humor, and like, and also like be a bit loud and boisterous sometimes, and we have like a good time with my clients and things like that. But for some people that might not be a good approach for them. Like, they might want someone who's a little bit more like quiet, or a little bit more serious, or a little bit more calm, and that kind of thing. So that's why I love working with a lot of ADHDs, because we just kind of like bounce off the ADHD. But for some people that might like, they might be like, oh my gosh, like, that's a lot of stuff going on there. So, so that's okay as well. Like, we're not just as much as, human to human with friends. We might not vibe with everyone. It's the same with professionals. Like, at the end of the day, we're just humans as well. We just have, a certain job title.
Yeah. And I think that, we are so like socially, culturally conditioned to position people like, therapists, doctors, lawyers in these really status positions of, power and authority that it feels like, we can't question or challenge. And yeah, and it's not really about questioning or challenging or saying to the therapist, I don't think you're good enough, or you're a bad therapist. That's not what you're actually saying. It's just saying that, yeah, there's a bit of a misfit here, and I'm going to explore other options. Similar to when you are dealing with specialist doctors, people are often encouraged to get a second opinion, because yeah, even in that medical space, there's a level of art and subjectivity to what a doctor does. And yeah, two different doctors will look at the same thing from two different angles and have two different ideas, and it's the same as with therapy. So it might be like a second opinion.
Yeah, that's second opinion. Yeah. So I don't know. I think we've covered a lot of ground today. I guess, was there anything else that you felt like was important to mention?
Um, no, I think maybe it is important to mention that that we've talked about making sure you're comfortable with the therapist and those different therapeutic approaches and neuroaffirming therapy. But I think something that's important to recognize is if you're going to see someone using like a mental health care plan, for example, then there are reporting requirements that don't necessarily fit a neuroaffirming approach, because for the mental health care plan reporting stuff, there has to be like goals and aligning with certain focused psychological strategies that have been used, and for that perspective it looks more structured. And same with NDIS, it's primarily skill building. So again, there's goals, there's particular approaches and things that need to be happening in that space. So keeping in mind that sometimes the restrictions around your therapeutic journey might come from the funding bodies, and having a conversation with your therapist about about that, and how can we operate in the ethical bounds of the funding requirements, but still meeting my needs. That can be helpful.
Yeah, that's a really good point, because yeah, at the end of the day, we do have to abide by the laws and policies, so we can't just kind of go completely off script. But I think, yeah, I guess it's just about being a bit creative sometimes, and sometimes it's about how you go about things rather than like exactly what it is. Like I find, making it a little bit more fun can be helpful, and um, you know giving a little bit more autonomy and exploration to my clients is really helpful as well. So, but yeah, but again, like if you're kind of going, oh, like what we're like doing these goals and things like that, like why, like I don't really want to have goals. Like what's going on here? Uh, and then your therapist might be like, okay, well, these are the reasons why we have to do these things and tick these boxes and things like that. So yeah, that's something that's really important to consider as well.
Yeah, yeah, I think so. And yeah, because it can change things, a lot, a little, but important to know.
Yeah. Awesome. Well, thank you everyone for joining us for this episode today, and we'll see you next time. You'll see us next time.